Healthcare-associated bloodstream infections are associated with increased morbidity and mortality, as well as increased healthcare costs and length of stay. Strategies to prevent bloodstream infections include vigilant hand hygiene and peripheral IV cannulation, or PIVC, practices. In January 2020, Royal Perth Hospital established a safe PIVC team consisting of 2 registered nurses whose role was to deliver a safer process for managing PIVC at the point of insertion and to promote and improve monitoring and removal of devices. Under the guidance of this team, a 6-month trial was rolled out in 12 service areas across the hospital.
The PIVC team came about as part of an initiative to look at addressing our hospital-acquired infection rates.
Mostly it was because our HABC rate, or hospital-acquired bloodstream infections, was really poor when we benchmarked against hospitals across Australia. We all found that really unacceptable and wanted to look at a new strategy. We actually pulled together a small team of staff and we had them undertake the competency for insertion of a peripheral intravenous catheter. Once they were competent, we set up a structure where they were observed for a while and then they went out there and operated as a team.
With the PIVC team, we had a prime focus of PIVCs and the proper and aseptic techniques surrounding them, educational resources for staff and being available to staff to teach them. They were unsure on how to insert a PIVC and just being a resource for difficult cannulas as well if staff were unable to insert a difficult cannula.
I think that the positive aspects are actually promoting the importance of cannulation and having a visual presence within the organisation around that. So they've certainly been really positive in being able to troubleshoot, pick up patients that perhaps didn't need a cannula. They've had over 100 patients in the pilot period. They were able to actually challenge and say, why did this patient need a cannula?
It's been a great help to those on the wards, just purely because doctors are so time poor, and having a team that's readily available to put in their cannulas has been a big help. And also to provide them with some feedback on how to care for their cannulas and manage them on the wards.
So we provide timely care as well, and we are there to assist difficult cannulations, where I've encountered some cases where 5 attempts have been made. And patients also are very happy that we're able to come quickly for their medications to be administered. So in that sense, I feel we can make a positive impact in healthcare through timely delivery of IV cannulations.
Successful cannulation can make the patient relax and not so scared of the needles. So those things were really rewarding for me.
From Royal Perth, where we introduced the pilot, we had a reduction in HABCs during that time, which was excellent. And the other thing was that people were very engaged in observing the IV sites and preventing infection. And we had really wonderful feedback from our junior medical staff who normally do the cannulas, and they really loved it and wanted to be taught by the team. So I think it had, multiple benefits across the hospital.
I think from a patient experience, these guys got really skilled because they were doing it all day, every day. The other thing that we found with our pilot results is 50% of the cannulas they were deeming as being difficult, yet they had a 95% success rate.
PIVC team demonstrated excellence in communication with all members of the ward clinical teams, and that was a huge benefit because they got people on board, which meant we were looking at cannulas and we were removing them and inserting them properly, and that really benefited the safety for the patient.
I think the most rewarding part of the role was being able to meet various people in the hospital and work together with various multidisciplinary teams around the hospital. It was great to really branch out and work with everybody. Also for our patients, ensuring that they are receiving the best possible care.